which was amazing. And what we were doing was offering them mental health support. And today's session is really about highlighting the importance of prioritizing mental health, especially during these very unprecedented times, very difficult times for the globe. And just to give you an overview today, what I will be doing is going through, firstly, just acknowledging and reflecting on the global challenges that COVID has presented generally, and then more specifically around mental health and the impact that that's had. And I will also be then talking about what when we talk about emotional agility and resilience, what are we actually referring to? And hopefully you'll be able to take away some practical skills as well, some practical evidence-based skills that's been backed up by science, psychology, and backed up by a lot of research. So I'm really happy to present this to you today, and hopefully you'll be able to take some nuggets by the end of today's session. And then at the end, we'll have a summary. At the end, we'll have a summary in order for us to, and also to offer you a chance to ask some questions as well. So here we go. So, the year of the global uncertainty and trauma. I think, as mentioned, it's very important for us just to really acknowledge what this year has, and these pictures really emphasize just how much has gone on, and hopefully these are familiar pictures that you've seen on the news, on social media, and also in real life as well. And I think it's important for us to just reflect on some of the things that we've been exposed to as a globe. I think this year has been, as mentioned, a very challenging one and a very uncertain one, and we still are in that uncertainty. So when we think about, again, some of the specific challenges this year has presented, we're talking about illness, we're talking about death, we're talking about job loss and lack of security, financial turmoil, loss, uncertainty, change, isolation. And while each of our experiences have been very unique and isolated, at the same time, we've been united in this experience, and many of us would have faced some of these, if not all of these challenges. So why focus on mental health? Surely COVID-19 is a physical health concern and a physical health epidemic. So why should we be focusing on mental health? And the reality, before we get into that, is actually, from what we know, obviously it's not just about mental health. We know that mental health has an impact on both our physical health, and it's not isolated. So as you can see from this diagram, we know that our psychological health is obviously interlinked with our biology and also our sociological areas of our life, our relationships, our social support dynamics. So actually, it's very important when we talk about mental health to recognize that actually it has an impact not on our physical as well as society as a whole as well. So this is just an idea about actually even before pre-COVID, we know that mental health has been a huge concern for the globe. We know that 15% of the world's diseases are mental illness. We know that in 2017, depression became the leading cause of disability globally, surpassing cancer, diabetes, heart disease. And there's an overwhelming research on the link between mental illness and chronic physical health difficulties such as heart disease and diabetes. So before COVID, we already knew that mental illness and mental health was something that affected a large part of the globe, and with lots of people suffering. And with COVID, we've seen that those numbers skyrocket. Before we can understand, again, some of the impact that COVID might have had on our mental health and would have had, I think it's very important to recognize actually what are some of the fundamental areas, fundamental factors that can help us feel more resilient, but also help us feel actually make us more vulnerable. And from that, we can understand how and why COVID might have had the sort of impact it's had on our mental health and our overall well-being. So the first thing is actually the environmental factors. We know that when there's a social protection, when we feel secure environmentally and when we feel safe, we know that we feel more resilient. However, when there's high employment rates and when we are exposed to trauma, etc., and we don't feel safe, we know that that actually is a risk factor and that makes us more vulnerable. And if we reflect back on actually COVID and the experience of COVID, understandably, this has made all of us very, very vulnerable because of those factors. The trauma, the unemployment, the economic turmoil. The other thing is social circumstances. Again, when we feel very, supported and we feel as part of a community, when we feel integrated and we're able to have that kind of physical, connection, we know that makes us feel more resilient. However, what this presented, of course, is that the social isolation, social exclusion, income has been affected, family has been affected. And again, we can understand why that's a risk factor and why, again, because of these things, COVID has made things even more difficult. And then on an individual factor, we know that when we feel we have the skills, when we know that we have good physical and healthy living, when we have good problem solving skills and good management of our stress, we know that that makes us more resilient. However, when we feel lonely, when there's work stress, when we feel physically ill, unemployment, all of those things, of course, act as making us more vulnerable and as a risk factor. So hopefully this gives you an idea of, and it gives us a broad idea of why some of the factors might have made us, the things that have made us more resilient, the things that might have helped our mental health had been taken away. And I guess that's exactly why, it's very important for us to reflect on this and to acknowledge this in order to understand to what extent and actually some of the areas and some of the impact that COVID has had on us. So specifically, I'd like to now reflect on actually, okay, what impact has COVID had mentally? This might sound like an obvious question. However, there is growing research on actually specifically, we know that the experience has caused a lot of distress. We know that the experience has caused a lot of anxiety, etc. However, what does that look like in research? What does that look like in numbers? But before we get into that, I'd like you all just to spend some time reflecting on actually your own individual experiences. How has COVID affected your mental health? I'd like you to spend a couple of minutes just reflecting on that. What changes have you noticed about yourself? What, in terms of your mood, in terms of your behavior, in terms of your habits, with the loss of routine, the loss of structure, how has it affected you? And I'd like you just to spend a few seconds reflecting on that, just to bring things to life a little bit. Like, as you can see from these images, obviously, COVID has presented lots of challenges mentally for a lot of us. Anxiety, depression or low mood, adjustment difficulties. We've gone through lots of change, and change isn't often an easy thing for us as human beings. So we know that, obviously trauma as well, PTSD, loneliness. We know that a lot of our healthcare providers, those on the front line, have been exposed to death, to times that we've never seen before, and that in itself, of course, will have a huge impact on all of us, regardless of what situation or circumstances we've been presented in, and regardless of what part of the globe that we're in. And these images really just highlight just some of those, as you can see, kind of worry, anxiety, kind of dealing with family life, being a healthcare provider. These are just some examples of some of the difficulties that it meant in terms of our mental health that COVID, the impact that COVID has had on us. So thinking about the groups at risk, we know that people with pre-existing anxiety disorders or health anxiety, have more of a risk in developing mental health issues now in COVID. We know that healthcare workers have high levels of anxiety, understandably, once again, because of the circumstance, because of the demand and the lack of, and the resources in some parts of the world, the lack of those resources. We know that unemployed and the casual workforce are at increased risk of poorer mental health during times, especially times of economic instability, and COVID did exactly that as well. We know that being in quarantine has its effects as well. Potential psychological effects of quarantine include depression, PTSD, confusion, anger, boredom, loneliness. And longer durations of quarantine include fears of infection, getting sick, fears of getting sick, financial loss and stigma associated with that as well. Also, people with pre-existing long-term health conditions have a higher, obviously, risk of developing mental health difficulties, especially during COVID, when there's, again, the high levels of distress. Obviously, the impact that it's had on our healthcare services as well globally. And in terms of the research, there is a growing number of research at the moment looking at the link between COVID-19 and mental health. And although there is an increasing number, that it's still very limited. However, a study by the University of Oxford and the Oxford Health of Biomedical Research did a study on some health records, millions of health records in the United States. And what they found was that nearly 1 in 5 people who have had COVID-19 are diagnosed with a psychiatric disorder such as anxiety, depression, or insomnia within 3 months of testing positive for the virus. Also, people with pre-existing mental health diagnosis were 65% more likely to be diagnosed with COVID-19 than those without, even accounting for known risks such as age, sex, race, and underlying physical health conditions. And this research is absolutely astonishing because what it highlights is, again, the link between our physical health and our psychological well-being, and how actually the two can't be separated. I think this is some real striking data that's come from this. The key themes that came from it, the most common diagnosis was anxiety, understandably, and I guess not surprisingly, but specifically adjustment disorder, generalized anxiety disorder, and post-traumatic stress disorder were the main themes that were seen or that presented itself. Research also shows that those being treated or working in intensive care units, or that can also trigger post-traumatic stress disorder. So we can see how that might present itself. Mood disorders were less common. However, we know that there's again a link between anxiety and depression, and anxiety and the two often don't present it themselves separately. So we know obviously that if somebody is experiencing anxiety, then there's going to be a high likelihood that that's going to present some symptoms of low mood as well. If you're constantly anxious and constantly worried, or you're experiencing very distressing symptoms of post-traumatic stress disorder or symptoms, or re-experiencing symptoms, then understandably that's going to have an impact on your mood as well. There's been a clear impact on mental health services as well. A survey conducted by WHO found that that there's been a huge disruption on mental health services. And again, that might not be very surprising, but specifically on mental health services. And they found that 93% of the countries worldwide reported that there was an impact on services. Specifically, over 60% of countries reported disruption to mental health services for including children and adolescents, as well as services that offer counselling and psychotherapy. So this is just highlighting that, again, not only was there a high level of distress and high levels of mental health difficulties experienced during this global pandemic, but also we've seen that how much of an impact also it's had on our healthcare services, specifically as well on our mental health services. We know that at the moment, Qatar is doing a longitudinal study at the moment looking at the link between coronavirus and mental health, and hopefully this will give us more data and more information around actually how the impact that COVID has had specifically on mental health, and we look forward to getting some of that data as well. But what does this all mean? This really all means that given the considerable increase in mental health difficulties combined with the severe mental health service disruption is likely to lead to further global mental health crisis in the aftermath of COVID. And that's something that we really, really want to prevent from happening, or at least try our best to support and to put in place plans and kind of strategies in order for us to help as many people and to prevent that from happening. But also this means that it's very important that we try to prioritize mental health now more than ever in order to reduce the likelihood of that happening. So what can we do? The reality is that we can, and the main reason and the main purpose behind this session is really to emphasize actually how important it is to actually empower our community to prioritize and take charge of our emotional well-being. Mental health has not been prioritized as much as physical health has been. But now hopefully more people realize actually we can't separate the two. And in order to manage and have a community and a globe that fights through COVID and fights through this period, we need to also work on making sure that our mental health is prioritized as well, and that we put in place support, and we put in place education, and we put in place give people coping mechanisms to be able to feel more resilient and to prevent kind of long-term mental illnesses from developing. However, a fundamental skill that sometimes is overlooked, and something that I've been very passionate about for several years in my career, is that of equipping people with the skills to be able to manage distress. And I use this term emotional agility to summarize that. However, this is basically the skills helping people understand how to not only understand distress and understand their emotions, but actually be able to manage it, be able to have the skills to learn to manage and kind of cope with high levels of distress. And unfortunately, this is not something that we're taught in schools. We're not taught to do this growing up. So many people struggle with this. And obviously this gets in the way of psychological flourishing. It gets in the way of recovery. And we know clinically it can get in the way of actually recovery as well if people have unhelpful coping mechanisms when it comes to managing distress. So cultivating emotional agility, now I'm going to kind of go into that and look at actually what we mean by emotional agility and what does that mean in regards to resilience. And I think it's very important as a fundamental beginning, as a step forward. I'm sure there are so many things that we can do for our mental health right now, but this, I believe, is a firm foundation. If you have the skills to be able to understand and manage distress and have evidence-based skills to be able to do that, that in itself will help you feel more resilient and help with the adversity, regardless of what that might be, because these skills are not just for obviously dealing through what's happening right now, but it's also about how do you deal with day-to-day stresses, but also adversity. I'm just going to take a pause at the moment and just check the chat. I'm just going to quickly stop sharing and check the chat. Thank you. I can see your chats coming through already. Brilliant. Brilliant. So what do we mean by emotional agility? And I'm also going to highlight another term called emotional hygiene. Now, before we get into Susan David, who's a researcher into emotions and a fellow psychologist, gave a really nice definition of emotional agility. She says it's a process that enables us to navigate life's twists and turns with self-acceptance, clear-sightedness, and an open mind. The process isn't about ignoring difficult emotions and thoughts. It's about holding those emotions and thoughts loosely, facing them courageously and compassionately, and then moving past them to ignite change in our lives. I really like this definition. It's definitely something that resonates with me, and it really fits with my own understanding and my own definition of emotional agility. And I'm going to present that to you now in terms of what I understand, when I'm referring to emotional agility and emotional hygiene, what I'm referring to. Now, emotional agility is our ability to understand and manage distress, uncomfortable emotions in a manner that promotes psychological flourishing. So we all have different versions of doing that. We all have different ways of coping with distress. It's a flexible approach to our management of distress. And what I mean by emotional hygiene, you might be wondering, what does that mean? It's about being mindful of our psychological health and adopting brief daily habits to monitor and address psychological wounds when we sustain them. It's about using compassion, openness, and curiosity and value-aligned living. Now, what does this mean? It means that if we adopt a way of being more curious with our emotions, regardless of whether they're negative or positive, we live in a society now that refers to emotions as positive and negative. And unfortunately, that encourages us to then judge ourselves. When you're having a negative emotion, as sometimes we say, sadness or guilt, we then judge ourselves, and that actually adds another layer of distress, and that's not something we want. We want to develop more of an openness, more of a flexible approach, a non-judgmental way of coming towards our emotions, because they're a part of our life, and it's a human experience that we need. And before we can actually learn how to actually work with them and manage difficult distress or emotions, we first need to understand emotions. And as I mentioned, we all have culturally and societally, we have different versions of what that means. And I want to refer to you to the key messages. We all received key messages about emotions growing up. We all have our own way of dealing with emotions when we experience them. And I'd like you just to reflect on that. When you were growing up, what were some of the messages you got from family, culturally, society about emotions? And also, how did you learn to deal with them? Because there are key themes in some of the societal messages. Some of the messages include, it's weak to show your emotions. It's bad. I shouldn't feel sad. I shouldn't feel anxious. It's weak. It's dangerous. I will lose control. I must stop feeling this. It's weak. It's bad. It's dangerous. These might sound like very They might sound like very kind of, you might recognize them, you might say them to yourselves, you might hear them in society, you might hear them in your culture, you might, regardless of where you live. But these are some very unhelpful beliefs, because actually what we know about emotions is that they are data and not directives. We know that emotions, there is no good or bad emotions. Emotions are neutral. There is no good or bad emotion. It's only when we judge them to be bad or good, that's when they become good or bad. And that adds another layer of distress, especially when you feel anxious and you're saying to yourself, I shouldn't feel anxious, I shouldn't feel anxious. It creates more distress. Emotion is a human experience. It's essential for survival. Anxiety, for example, it keeps us safe. Anxiety is a big part of our programming in order to keep ourselves safe, because we want to be safe. We want to make sure that we're not walking in front of cars or walking off cliffs, etc. So an emotion like anxiety is very important for us. We also need to recognize that emotions are not permanent. They come and go. They're temporary. So again, another way of looking at emotions is actually it will pass. Emotions are here. They're not going to be permanent. And that's part of some of the helpful ways of looking at emotions. Before we can actually change anything, we need to be able to shift how we see them. We need to shift our beliefs about emotions. We need to shift these unhelpful messages that we've been presented with, and also we say ourselves as well in society. So these are some of the ways that often people manage distress. And these are very, very important to highlight, because these are very destructive and actually get in the way of healing, get in the way of recovery, get in the way of a psychological flourishing. You might wonder why there's a beach ball there, but you'll understand why. The first one I see in clinic, and throughout the number of years I've been in clinic, is a very common coping mechanism is suppression. And the reason I call it the beach ball effect is what happens with suppression is people often push down their feelings. They tell themselves, no, I shouldn't be feeling this. I'm just going to block it out. I'm just going to block it out and put it to one side. The reality is research shows that actually that's more destructive, and actually that can cause even more harm. And the reason it's the beach ball effect is what happens when we push down a beach ball in the water. The more you push it down, what happens is actually the symptoms are more intense. What happens is they come back more frequently, and they're far, far more distressing. A lot of people avoid situations or bottle things up. They dwell. The opposite of suppression is when people drown in their emotions and they feel they can't get themselves out of it. Situational avoidance, we're seeking distraction, numbing and withdrawing. A lot of people sometimes, use alcohol or diet through emotional eating, or as some people call it, comfort eating, through other forms of unhelpful coping mechanisms, smoking, etc., as a way of regulating their emotions. And that actually, again, leads to more long-term difficulty. So these are some of the coping mechanisms I want you to keep an eye on and hopefully try to disengage from. But what is the price of emotional rigidity or poorly managed emotions? We know that when people struggle to manage their emotions or regulate their emotions, this brings lower levels of overall well-being, poor problem solving, depression, high levels of anxiety, relationship difficulties, chronic physical illness. Again, we know that there's a huge, masses and masses of research show the link between mental health and physical health. But this is something, again, to just keep an eye on. You might be wondering, why is it important for us to manage our emotions? This is a fundamental skill that we all need in order to flourish psychologically, and also for overall emotional and psychological well-being. As part of regulating our emotions or emotional agility, it's important that I draw your attention also to understanding thoughts as well. And thoughts, because from what we know is that our thoughts trigger how we feel. Our thoughts trigger emotions as well. And there's a link between those two. If you feel like you're not good enough, you'll have thoughts that you're not good enough or not worthy, or you have thoughts that something bad's going to happen to you. How do you think that's going to make you feel? How do you think that's going to kind of make you feel overall? It's not going to make you feel very good. So we know that part of managing distress, part of managing emotions is also about managing our thoughts. We have about 60 to 80,000 thoughts a day. And by default, because of how we've been programmed, we know that a lot of those are negative. A lot of those are also recurrent thoughts that you've been telling yourself for several years based on the experiences that you've had, the, significant events, the traumas, your early upbringing. All of these will have an impact on the sort of beliefs and thoughts that you say to yourself on a regular basis. And that will also have an impact on how you feel. I'm just going to take a pause again just to check the chat. Okay. Thank you. So how do we cultivate emotional agility and resilience? That's probably the answer you're asking yourself. The key thing is we need to pay attention to actually what you're feeling. A lot of us lack the emotional vocabulary to be able to label what emotions we're experiencing. And so a really important part of emotional agility is about being able to name your emotions, being able to label them. Do you feel disappointment or shame, guilt or sadness? Being able to name specific emotions you're experiencing, research again shows that is a crucial part of this. Bringing acceptance, as mentioned, openness, curiosity, and compassion, as opposed to judgment, shame, and critical and being self-critical. We know that being able to engage with your values and direction as well. So recognizing that also our emotions align us with our values. So actually, some important things to ask yourself is, what is this emotion telling me? I'll go on to some helpful questions you can ask yourself as well. And then through understanding and through recognizing, then we move on to detachment, because we're not saying that you have to sit with those. We're not saying you have to remain stuck with those emotions. We're saying that it's important to acknowledge, offer validation, acknowledgement, compassion, curiosity, and then move through them. Research shows that the radical acceptance of all our emotions is the cornerstone of resilience, thriving, and authentic happiness. So how can we bring what we've learned to life? One of the most important skills to learn is about self-awareness. How well do we understand ourselves? How well do we understand our emotions and the sort of experiences we're having? And some helpful reflections to ask is, what is this emotion I'm feeling? What is this emotion telling me? What thought or worry may have triggered this? What is my body telling me? Are you experiencing palpitations? And understanding the difference between primary and secondary emotions. Primary emotions are the emotions you initially experience. So if something happened, that initial experience, whether it's sadness. But sometimes what we do is we add a secondary layer when we judge ourselves, and we tell ourselves, why are you experiencing that? I'm weak for experiencing that emotion. A fundamental part is also even using the words and using our language. I am feeling sad. I am feeling anxious, as opposed to I am depressed. I am anxious. Even the differences makes a huge difference. So also learning to talk differently, or learning a different way of talking about our emotions also has an impact. These are some helpful tools and techniques that can help you start to become aware. The first one is the 5 areas diagram, which I'll show you a diagram. The other one is journaling, which you might have heard of, and there's thought diaries as well. And what these do is they just help you learn to start asking yourself these questions and and actually helping you start recognizing what it is that you're feeling. Again, it's important you bring compassion, kindness, and openness to that process. The 5 areas diagram is this. So it's just about being able to bringing awareness to the situation that, anything that might have triggered how you're feeling, your thoughts, your emotion, your physical symptoms, and what you may not have done. And this is just, again, about heightening that awareness. So you can take a screenshot of this if you want, just to remind yourself, but I'll also be leaving some helpful apps that you can use on your phone as well. Some other helpful tools and techniques include the gratitude and gratitude journaling. Gratitude can sometimes, there's a lot of research that backs that up as well, and that links that to emotional wellness, but also imagery and present moment focus, visualization and relaxation exercise, which I'll also be going into. So some exercises that can sometimes, because I know it's very easy to say manage your emotions, or it's important to be open to them, but often emotions are incredibly intense and incredibly distressing, and it's understandable that you're going to want to run away from that. So these exercises, once you've acknowledged and you're building up that awareness, now we're moving on to how do we kind of shift through that? How do we help alleviate some of that distress once we've acknowledged, once we've labeled, once we've gone through that initial process? And these next exercises will help you do that. And the reason I've got this image on here is, in order to understand what these exercises do, it's important to understand what it does to our body. And this is the autonomic immune system. And everyone has that. And we have the parasympathetic system and the sympathetic system. And the sympathetic system is when our body goes into fight or flight response. And this is when we feel anxious. And what we don't recognize is a lot of our body goes into a state of stress. Cortisol is released, which is a stress hormone that suppresses our immune system. And often we go into this stress response without even realizing. We go into this stress response without, sometimes with simply our thoughts. So it's important to understand what's happening in order to benefit from these exercises. Then we have the parasympathetic system. The parasympathetic system is when our body goes into recovery, so the self-soothing stage. And what these exercises will do is actually help you switch from the sympathetic system to the parasympathetic system, just through these exercises, so that your body can go into recovery, so that your distress levels can be reduced. And you can do this by these very simple breathing exercises. This one is the 1, 2, 3, 4, just inhaling through your nose, exhaling through your nose, and repeating this. These exercises often take a few minutes. Visualization is very important. This can really help. This is an exercise that we use in an approach called EMDR at the initial stages. And this is just about actually the importance of how the things of visualizing and imagining things actually has an impact. And the reality is our brain, because it's designed for survival, it doesn't know the difference between what's real and what's imagined. So when you're bringing up these very scary images in your mind, what happens is it triggers the sympathetic system, it triggers the fight or flight response. So actually what we can do is we can shift that just through what we bring up in our minds. So this exercise is just a short exercise. Again, you can take a screenshot of it. In terms of time, probably won't be able to go into all of it, but it's about visualizing a safe space and then installing that. And installing might sound quite strange, but it's a way of actually embedding that, so that what you're doing is you've got an image and then you've got a word. For example, your safe space is, a beach somewhere, and the word is tranquil. And all you're doing is bringing up the word and bringing up the image, and then you're installing it by simply tapping on your thighs or your shoulders, and that actually helps embed it. Again, this requires a lot more discussion, but this is, again, you can take a screenshot and you can also ask some questions if you need to. And then there's present moment focus or mindfulness. I know we refer to mindfulness a lot, but present moment focus is something you can do on a day-to-day basis. It's, simply bringing your attention to the present, to the now, through actually acknowledging what's around you, the textures, the smells, what you can see, what you can hear. This again helps shift those distressing emotions. And we're not using them as a way of running away from the emotions. Remember, the initial part is acknowledgement, openness, curiosity, and then we move on to actually shifting those emotions. So in summary, these are just some things you can try. Self-awareness, developing openness, curiosity, and self-compassion, emotional intelligence, building routine and building value direction living, problem-solving skills, as well as cultivating the foundation, sleep, diet, exercise. These are the fundamentals as well that it's important we take charge of. These are some useful apps that can help you through this process, help you through managing distress. Breathe is a good app. Calm, CBT Thought Diary, specifically if you want to capture your thoughts, and Headspace. These are some really helpful apps that you can try. There is a free trial on them, but these are just some exercises. Some of them might, you may want to choose which one works better for you. So final thoughts. I'm just going to quickly stop sharing again and just check the chat. Final thoughts. Just to summarize, I think it's very important that we just reflect on what we talked about. And the fundamental thing is that in order for us to move through this and move through this very difficult period and in order to improve our mental health, it's very important that we prioritize it, but more importantly, we engage in the fundamental aspect of actually bringing awareness, bringing compassion, bringing curiosity, especially when it comes to managing distress. We've talked about the research of kind of the impact of COVID. We've talked about the mental health and how it's affected society, but we've also talked about some tools and techniques and actually why emotional agility is important. I'd like to leave you with this short quote about to end it today, and it's by Susan David again, and I think this just sums up what we're trying to do. It says, as with every hero's journey, our movement towards a better life begins with showing up. But that doesn't mean we have to smite or slay all the demons, bad bugs, or even the spooklets that trouble us. It does mean we must face up to, make peace with, and find an honest and open way to live with them. When we show up fully with awareness and acceptance, even the worst demons usually back down. Simply by facing up to the scary things and giving them a name, we often strip them of their power. We end the tug of war by dropping the rope. I'd like just to leave you with that. Thank you so much for listening to me today and for being with me today, especially with this topic, which is very dear to my heart. And I think it's a very, very important topic, and I hope you found it useful. What I'll do is go back to, here's some references that I've got. I'll go back to the chat now and just highlight something that one of you has said. Reem said, I think we should minimize watching, reading, or listening to news about COVID and causes us to feel anxious. We should seek information only from trusted sources. The media is playing a major role sometimes in delivering stress and affecting our mental health. 100% Reem, thank you so much for sharing that. I couldn't agree more. I think that's such an important, listening to things, exposing ourselves with news. I think news is very important to give us the information, but sometimes it can create addictive behaviors, and sometimes we can be so glued to the news, and that can cause us a lot of anxiety. Remember, our brain doesn't know the difference between what's real and what's imagined. So if you're constantly exposing yourself to these difficult, distressing images, it will just keep triggering that kind of fight or flight response that we talked about. It's been a real pleasure being with you today. I hope this has been beneficial. If you need to get in contact, my email is ninaoma@ymail.com. I'll just quickly put that in there. Nimo@wayak.com. nemo@wayak.qa. It's been a pleasure being with you all today, and I hope you enjoy the rest of the conference. It's going to be an amazing rest of the next few days. Have a good evening. Thank you very much.